certain of their Medicare Advantage plans offer access to their national network, meaning that if you're in Pittsburgh and there's care that you want to seek in Cleveland or Columbus or Minneapolis, if the provider you're going to see out of your home service area is part of your plan's national network, that'll be covered at in-network rates. Good morning, insurance agents of the senior market. Welcome back to another episode of Near and Far. It is Wednesday, June 2nd. Happy to be in June. Certainly excited to see that calendar turn over. June is one of my favorite months of the year. Hope it is yours too. So today we're going to be bringing to you the third episode from our 1,000 subscriber celebration, where we went to you, our loyal viewers, and said, hey, hit us up with any sort of content ideas, things you'd like to learn about, things you'd like to hear us talk about here on the show. And we can't tell you how appreciative we are for all of these ideas. Still much more content going to be coming to you from that tremendous response that we got. If you have other content ideas, other things you'd like to see us shoot here on Near and Far, hit us up right here below at our email address. Those of you probably know it, but just in case, it is nf_studios@neishloss.com. Be happy to take your content ideas and try to work it into the show. So this particular episode is coming from our agent, Kim Harris, who's actually based here in Western Pennsylvania. Kim, we love doing business with you. We appreciate your feedback. So Kim wanted to learn more about out-of-network coverage on Medicare Advantage plans, as well as emergency services. And the differences between those, how different services are covered or charged. And so we're going to bring that to you here today. So first off, let's take a look at emergency care. First of all, what is it? How is it defined? And how do various Medicare Advantage plans cover it in the context of your benefit summary? So let's take a look here at how Medicare defines emergency care. So Medicare on their website, on medicare.gov, says emergency services are when you have an injury, a sudden illness, or an illness that quickly gets much, much worse. Now, another way to say that might be that it's care that cannot be reasonably postponed until you return to the service area. So in terms of how Medicare Advantage treats emergencies, let's take a look at that specifically. So if you're on a plan that is a network-oriented plan, in an emergency service, you need to go to see the doctors or hospitals that will be able to best treat your coverage. And if you are out of network, if the provider or the hospital that you're going to see is not part of your plan's network, that's going to be covered at in-network rates. So just to summarize, if you are in an emergency situation as a Medicare Advantage consumer, you need to go seek care in the most reasonable form available to you, and your Medicare Advantage plan must cover that at in-network rates. So now let's look at the second piece of this. When we're talking about non-emergency care, how is that covered on an out-of-network basis? So your three most prevalent types of Medicare Advantage plans are HMOs, PPOs, and point-of-service plans. Now, with an HMO product, you don't have any coverage out of network. Now, you've got emergency care out of network, but again, we're talking about non-emergency services. So HMO plan, you go out of network for non-emergency services, paying out of your pocket, paying 100% of the cost. Now, on PPO and point-of-service plans, you do have coverage out of network for non-emergency services, but you're probably going to be paying a significantly higher rate for that care. That'll be defined by your summary of benefits. But again, you're not paying in-network rates for that non-emergency care. Many times you're going to have a deductible and potentially some fairly significant co-insurance to drive along with that that's really going to eat into your pocket. Now, we are seeing a lot of carriers release national network plans. We've seen them from United Healthcare, we've seen them from Aetna, we've seen them from others, where certain of their Medicare Advantage plans offer access to their national network, Meaning that if you're in Pittsburgh and there's care that you want to seek in Cleveland or Columbus or Minneapolis, if the provider you're going to see out of your home service area is part of your plan's national network, it'll be covered at in-network rates. Now, that doesn't mean that every provider in Cleveland or Columbus or Minneapolis would be part and covered by in-network rates. But again, if you're on a plan that offers national network access, you can go see the providers in that plan's network and be charged in-network rates for those services. Additionally, there are some plans that are part of the Blue Cross and Blue Shield network sharing program. We see that here locally with Highmark Blue Cross Blue Shield. There are other Blue Cross plans that we work with across the country that offer this, but be aware, not all Blue Cross and Blue Shield plans participate in this network sharing. So for those that do, if for example, if you are a member of a Highmark plan that offers this, you can go to see other participating Blue Cross and Blue Shield providers who will give you the ability to access them in terms of care and services at in-network rates. So to summarize, really what we're talking about is emergency care under MA, covered at in-network rates everywhere. In terms of non-emergency care, if you have a plan that offers national network access or is part of the Blue Cross and Blue Shield network sharing program, you've got expansive access to providers at in-network rates. If you're on an HMO plan, it's all out of your pocket. Sorry, that's just kind of the deal you signed up for. PPO and point of service plans, you can see any provider that you'd like, but you're probably going to be paying a pretty penny to do so. Well, Kim, we really hope that addresses your question. We thank you so much for sending that to us. And again, be looking out for those Amazon gift cards that you had sent to you. Don't make sure that you spend them all in one place, or don't spend them all in one place. Spend them however you want. It's your $250. Enjoy it. We'll be back with you on Friday, June 4th at 7 a.m. here on Near and Far. I'm Bill. Can't wait to see you again. Thank you so much.